Hello, you have an appointment for a magnetic resonance imaging scan, otherwise referred to as MRI. This scan can be confused with other types of investigations in the radiology department, such as CT scan. This DVD will give you a brief demonstration of what to expect from arriving at reception to leaving the department. When you arrive at reception, the clerk will ask you for your details, and if you have answered yes to any questions on the safety questionnaire, you have received with your appointment letter. This is why we ask you to arrive early for your appointment. Why do we ask so many questions? Well, MRI scanners use strong magnets to form images of the body. However, this strong magnet means there are some patients that we cannot scan. The important things to tell us include whether you've had a pacemaker or an artificial heart valve, if you've had any operation with surgical clips, if you have had any medical implants, for example a diabetic pump or a cochlear implant, if you've had any operation on your head or spine, if you have any metal fragments within your body, if you've had an operation within the last 6 weeks, if you've had any injury to your eyes involving metal fragments, for example whilst grinding. This question is very important regardless of how many years back this might have happened, as a fragment can remain in the eye unnoticed for many years. If you have any doubts, we will investigate this further prior to your scan. We will also ask female patients if there is a possibility of you being pregnant. You will be asked to remove all metallic objects before entering the scanner so that they cannot interfere with the scan. These objects include things such as hair clips, glasses, hearing aids, nicotine or pain relief patches, money, jewellery, watches, pens, keys, mobile phones, underwire bra, and so on. You will lie on the table head first or feet first, depending on what body part is being scanned. Most MRI exams take between 15 to 45 minutes to complete, depending on the area being imaged and how many images are needed. The radiographer will ensure you are comfortable so that you can stay as still as possible. This is important as movement will cause the images to be blurred. Before the scan starts, you are given a call bell which allows you to contact us at any time. Whilst in the scanner you will not feel a thing, but the scan itself can be very noisy. You will therefore be required to wear headphones that, if you wish, can play music. They also allow us to hear and speak to you. There is also a camera in the room which allows us to observe you at all times. For some MRI studies, a dye called gadolinium may be injected into a vein to help obtain clearer pictures of the areas being examined. MRI is a painless procedure. However, if you suffer from severe claustrophobia, please feel free to contact us, or it may be worth visiting your GP to obtain sedatives prior to the examination. You will not receive the results on the day to allow the radiology doctors to look at all the scans. The results will then be sent to your referring doctor, who will discuss the results with you.